Hi and welcome to 15 Minutes with Longevity. I'm Giselle Wertheim-Ames and I'll be your host. In the studio today I have Dr Joanne Miller, an ophthalmologist specialising in age-related macular degeneration. We're going to be speaking about why eye health is so important and what can we do to keep our eyes healthy. Thank you for joining me, Joanne.
Thank you for your invitation.
Pleasure. So Mark Twain said you can't depend on your eyes when your imagination is blurred. But when your eyes are blurred, it's really difficult to do much in life, whether it's work or play. Can we talk a little bit about why eye health is so important and why we should be keeping an eye out on what happens with our eyes?
Well, our vision is vitally important for our independence, reading, writing, recognising faces, and especially for driving on our Johannesburg roads. So it's vital that we keep our eyes as healthy as possible.
What are the most common eye problems that you see on a day-to-day basis?
Well, my practice concentrates on medical retinal diseases. I mostly see aging patients with age-related macular degeneration. I have many diabetic patients who have complications of their disease. And then I have a small group of patients with inherited conditions like retinitis pigmentosa.
Okay, so and genetically driven diseases.
That's right.
What do you advise people in terms of how they should be maybe marking out their eye health milestones in their eye health? Should they be going to the optometrist or a GP? How does that work?
Well, most importantly, they need to look after their eyes. So the healthier your body is, the healthier your eyes will be. So basic principles of healthy, balanced, low-fat diet, weight control, gentle, regular exercise, regular checkups with their general practitioner to exclude high blood pressure, high cholesterol, diabetes. And then, of course, absolutely no smoking. Smoking is toxic to the eyes. Sun protection under our African sun is also vitally important.
So should people be wearing sunglasses often? Again, you know.
Sunglasses from childhood. We're not as aware as we should be of sun
And what
protection.
kind of sunglasses? I mean, should they be Polaroid lenses or plain lenses?
I would advise either Polaroid or 100% UVA and B protective.
Okay.
So there must be a full protection.
Okay, so you mentioned diabetes, which is a growing problem in South Africa. In fact, most South Africans, if they don't die of HIV, it's going to be of hypertension or diabetes as they age. What is the relationship between diabetes and your eyes?
Unfortunately, diabetes that is not well controlled can affect every part of the eye, and it is one of our common causes of blindness. And the most dangerous thing that it can do is affect the blood vessels of the retina, called diabetic retinopathy. So the most important thing is tight diabetic control, and in fact is avoidance of type 2 diabetes by exercising more, weight control, dieting, because our Western diet and our sedentary lifestyles unfortunately lead to a lot more diabetes than we've ever seen before.
We spoke earlier on about the importance of, you speak about exercise, but a lot of people, the sedateness comes also from the modern lifestyle, sitting in front of computers, playing computer games or the television set. Are there particular tips there, for example, how we should control or manage that interface with particularly electronic equipment?
Well, I think for children especially, time in front of these games and computer games needs to be limited. For those adults whose workplace job involves computer work, it is important that they have a good seating position, that they rest often, and that they lubricate their eyes. Because as we concentrate on the computer screen, we tend not to blink as often as we should.
Okay. Now, how should people deal with tests? Who tests a person for eyesight? Is it an optometrist? Is that where we go first to have an initial test?
Optometrists and ophthalmologists work very closely. And I would always say that the optometrist is your first port of call. We're talking now about aging conditions. So most of us from the mid-40s start needing reading glasses. So that's when you need
So there's nothing wrong, 'cause I think
it's normal.
You think, oh dear, brain tumour.
Not at all. It's normal. Our arms are no longer long enough and we have to get magnification to read. And that's often people's first introduction to an optometrist. They should be seen at least every 2 years. And the optometrist screens for aging conditions such as cataract, macular degeneration, glaucoma, and would refer on to an ophthalmologist if there's a problem.
But there's nothing you can really do about that. That's just part of the aging process. I mean, again, are there certain vitamins or lifestyle habits that you could adopt that may, I won't say stave it off, but maybe maintain it a little bit better?
Well, all those things that we've discussed already, low-fat, healthy diet, weight control, sun protection, no smoking, will aid in slowing down eye diseases of any sort, make them happen later, less severely, more amenable to therapy. So it's vital that you look after yourself to look after your eyes.
In families, if your parents have bad eyesight, are you generally going to have bad eyesight as well?
Well, there's a strong genetic risk.
Okay.
So it's always advised that children are screened preschool to check whether they need spectacles or have a squint. And if children do have a refractive error or a need for spectacles, they should be seen on a very regular basis.
So refractive error would be?
The need for a spectacle or contact lens correction.
Okay. Okay, so those are things as parents we can also be wary of and monitor and manage.
Absolutely, and most schools nowadays have screening tests as well.
Now, I'm very intrigued by the rate at which technology has also transformed this category, this medical category, in terms of the types of tests that are available, the kind of scanning. And can we speak a little bit about that? I'm sure 5 years ago what you could see in the eye compared to today is vastly different.
Absolutely, and it's a constant learning curve for all of us in ophthalmology, because technology is developing at the most rapid rate of any specialty in medicine. So the beauty of ophthalmology is that there's a mixture of medicine and surgery, optics and lasers, but that all involves new equipment that is developing rapidly and is all computer-based and needs training and updates. But we can no longer work without our technology. I certainly can't do a house call nowadays. I need my practice full of equipment. And it often gives me a far better resolution of the eye and of the retina than I can see clinically.
I was actually reading the other day about some mobile applications that have been developed for rural areas now, where they can actually test particularly the elderly for cataracts using a mobile device, which is absolutely extraordinary if you think about it.
Yes, there is a big drive, especially in this country, towards telemedicine, where we photograph patients in rural areas and send the images into cities where doctors would then screen the photographs and make diagnoses. Our vast population in the rural areas are underserviced by ophthalmologists, and those types of applications and telemedicine are vital.
Are we seeing, I mean, often with what's happening in medical science, because now information is more freely available and people are also a lot more aware about general health issues, are we seeing more reporting of health? So we see a lot of stats towards growing trends of people with particular diseases. Or is it just that because of our lifestyles we are seeing more disease, and is it the same true in the area of eye health?
Absolutely. I think largely because of our lifestyles, there are certain diseases that are actually stress-related, and we're seeing an explosion in Johannesburg especially.
So tell us a little bit about those.
Diseases. They are diseases of the retina that are worsened by release of adrenaline. Okay. So when we're under stress, we release enormous amounts of hormones, stress hormones like adrenaline and cortisone, to cope with that stressful event. But if stress is ongoing, constant, continuous, unfortunately some part of the body has to have a problem. So some people develop high blood pressure or heart attacks or stomach ulcers, and some develop an eye disease called central serous chorioretinopathy. And really only lifestyle modification, relaxation, gentle regular exercise controls that well.
And how would that show itself in a patient? What would happen to them if they had that? How would that show?
Well, they're usually young, ambitious, type A personality, business people who develop blurred vision. And
this happens one day.
Yeah, suddenly develop blurred vision and may then first see their optometrist, and our scans in an ophthalmology practice shows leakage and swelling at the back of the eye. That needs management.
So again, you say that'll be a lifestyle adaptation, and will it go away if they actually treat it that way, or is it something that they have to live with for the rest of their lives?
Well, they have to manage it chronically, because if we are type A people, that stress, personality, anxiety is often part of your nature. So it's really a consciousness of it and trying to control it as much as possible. So there are treatment modalities, but each person has to look after themselves better.
This is one of the categories as well where there's just no miracle pill, is there? There's no pill that someone can take, no drug that has been made that can correct problems.
And especially for age-related macular degeneration that affects so many people, there are multivitamins that have been developed to slow the process once you have it. And even those are controversial, but they certainly don't prevent the disease if you take them sooner.
And we're talking about your omegas and probably astaxanthins and...
Mainly the lutein, lutein and zeaxanthin, which is a green pigment found in dark green vegetables. And it's also found in the retina. So again, dietary changes.
Eat more spinach.
Yes.
That's what your mother always told me. My mother always told me, or tried to get me to eat spinach.
A daily portion of dark green veg, 2 portions of an oily fish, which helps with the lubrication of your eyes. That's the omega-3s. Vitally important.
So I think probably, again, we're looking at eye health, best thing, treat it like any other really important part of your body, like your heart, like you do your breast when you're a woman around cancer. Take care of it and look after your lifestyle. Is there anything else that we should be considering?
Well, I would say that if you have disease in your family, if there is known glaucoma, macular degeneration, then you must be screened at a younger age. You must be proactive about seeing an ophthalmologist regularly.
One last question for you. I mean, if there's any one development that, from a medical science point of view, that really excites you in the area of ophthalmology and progress, what would you say that is?
In the area of macular degeneration, where the retina starts bleeding and leaking, when I started in ophthalmology, we basically sent our patients home to lose their vision and go blind. Now we have an intravitreal injection that can control the disease.
Wow.
Very exciting.
Yeah, that is. Thank you very much for being with me today.
Thank you.
Well, that's it for this episode. Join us again next week, where we'll be looking at how a groundbreaking study shows more needs to be done to curb smoking in South Africa. Stay well, be healthy, and I look forward to seeing you here next week for your dose of health news.